Hello, my lovely anatomist and physiologist, Michele here. Before we dig deeper into the reproductive system, I did want to address a couple of or several really tough topics that are not fully addressed in our OpenStax textbook, but do have relevance to our everyday lives as we do experience ourselves and our reproductive health. And for those of you who want to dig deeper or check some of my facts, I have linked some additional resources in the printable study guide, which is linked in the video description. So please, I encourage you to check out some of those resources for information. With all of our body systems, we have addressed, what is the average textbook adult experience, and that's what we're doing also in the reproductive system. But just like all body systems, we don't always see that our bodies function or are even organized in the same way that the textbook describes. And in the case of reproduction, very often, especially for those of us socialized as women, we feel some of our worth connected to our ability to reproduce. And so I think it's important for us to see that even in the context of this chapter, while we talk about the textbook average experience, that some of that experience does include issues such as infertility, trouble conceiving, and even miscarriage. In addition, I'd like to take a little bit of time to draw your attention to the issue of reproductive justice. So let us actually begin with infertility. And when we're talking about infertility, we see that this is the inability to conceive. We'll see that this is pretty prevalent in the United States. The CDC says about 12% of women reproductive age are actually infertile. And so I tried to kind of convert that into a number. How many women in the United States are dealing with infertility? I was able to find some information that said there's about 72.7 million women in the United States. And so in that case, we would have about 8.72 million women struggling with infertility. I see that my pen is kind of doing weird writing, and I apologize for that. I'm not sure how to fix that at the moment. So hopefully I'll get that taken care of for the next video. So infertility is occurring in about 12% of women in the United States. And so we're seeing that as a number of maybe 8.72 million women in the United States having this inability to conceive. When we talk about trouble conceiving, in this case, we're seeing a reduced ability to conceive. So this is occurring in about 1 in 10 women. And this is ages 15 to 44. And so again, we're seeing, a high level of difficulty, trouble conceiving, and infertility. Now, what's causing these particular things? There's a whole list. There's a whole list of different causes. And I think as we study through the reproductive system, you'll get this feeling, and I'm seeing this in the discussion posts on our D2L class, you're getting this feeling of, oh my goodness, the human body is super complex, that all of these things have to be functioning exactly so in order for the whole system to be working. And very much this is the case when we talk about the reproductive system. So we'll see, especially in female body types, you have to have coordination two two sets of hormone cycles, one set that's happening in the ovary, another set that's happening in the uterus, and these have to be coordinated just exactly so to be able to have fertility. And then the tissue of the female internal reproductive anatomy has to be healthy tissue, which is not always the case. And the whole body needs to be healthy. So individuals who are struggling with chronic illnesses are going to have difficulty conceiving or infertility. Individuals who are struggling with endocrine disorders, so if your hormones are not in balance, and this can cause difficulty conceiving. Individuals who've had damage, disease, or injury to their reproductive organs can have difficulty conceiving. Your age can affect your ability to conceive, and we'll see that this is true for both male and female body types. So the older we are, the more difficulty we would expect to have in conception. Okay, moving on to this idea of miscarriage. And I had never had this thought before, but in reading the literature that I've posted for you from the Mayo Clinic, they talk about sort of this terrible name, miscarriage, because this word sort of indicates the female body, the pregnant person, is carrying the fetus all wrong. And this is the reason that you have a pregnancy that does not come to term. And of course, that is not the case at all. When we talk about miscarriages, we'll see that 10 to 20% of pregnancies will actually end early. And that's what we're talking about when we're talking about a miscarriage. We're talking about a pregnancy that does not come to term. We see that typically these events are occurring in the first trimester, where trimester is talking about the first 3 months of the pregnancy, so extremely early on. And what we'll see is very often this is occurring because there's a fetus abnormality. So something about the development of this fetus is not happening in the way that it should. So essentially what this is talking about is you don't have really a viable pregnancy at this point. That fetus is not going to develop normally, and that is the source of the miscarriage. And so this is not due to the pregnant person's ability. This is not something that the pregnant person did. And so I am bringing up this particular topic here because I think it's important that we're not tying our worth to our reproductive abilities. So let's so our reproductive health is not determining our worth. And I think when we think about difficulty with our cardiovascular system, or difficulty with our urinary system, or if we have asthma and we have difficulty with our respiratory system, we don't automatically think that we're broken in some way. We just think, oh, I have asthma. And I think very often the experience for folks, especially people who are socialized as women, is to have a sense of, it is my job to conceive. It is my job to have a full-term pregnancy. And if I'm not able to do that, I am in some way significantly broken. If you're feeling along those lines or just want to investigate that idea a little bit more detailed, there's a great episode of We Can Do Hard Things with Glennon Doyle, her sister Amanda, and her wife Abby Wambach, and the actress Gabrielle Union. And Gabrielle Union has experienced both infertility and surrogacy, and she talks very real and honest about that. So I've linked that for y'all in your additional resources if you want to investigate that fully or further. The next thing that I want to talk about is what I have listed here as reproductive justice. And so reproductive justice is talking about, we will see about 700 women in the US die from pregnancy related cause. And this is determined within 1 year of a pregnancy. And so when we do talk about reproductive health, and when we do talk about pregnancy, it is important to pay attention that the pregnant person is asking their body to do a lot. I read or listened to a radio program that was talking about human endurance, and they were studying the human body and all the amazing things that humans can do, including climbing Mount Everest. And it was determined that being pregnant was the highest endurance activity that the human body can actually do because of the amount of time and resources that are dedicated to this particular, let's say, adventure. Okay. Now, when we are talking about these 700 women in the US that are dying every year, so let's put each year, from pregnancy-related causes, we'll see that greater than 56% of these are either during labor or in that first week postpartum. And then we'll see about 13% of these are occurring within 6 weeks to 1 year. And so I think, again, it's important to pay attention that we are looking at pregnancy as a very serious health concern, health risk for those pregnant people. When we look at the data and we compare the experiences of white pregnant people and pregnant people of color, we will see that there is a significant disparity in these outcomes. So we'll see, I saw, depending on the age of the research groups, depending on the education of the research group, somewhere between 2 times to 4 times higher rates of death occurring in people of color compared to white people. So there is data, and I've linked that information to you also in the printable study sheet that's in your video description. If you would like to read some more information about that, I have 2 different resources. In addition, we'll see that people of color are more likely to have an increased risk for preterm births, low birth weight births, and infant death. Infant death is 2 times more likely for these families. So when we talk about reproductive justice, there's 2 aspects here. Number 1, this is a risky medical issue for all pregnant people. But more significantly, when we start to compare different ethnicities, we will see that those pregnant people of color are disproportionately bearing the risk of this pregnancy. And this is true for those infants as well. And so we are seeing some pretty startling data when we come to looking at maternal health care and disparities existing between white people and people of color. All right, stay tuned. As always, take care of yourselves and each other.